You ready? Everybody ready? Well, good afternoon, everyone. Since taking office, my administration has been committed to providing access to health care and creating safer communities for all Kentuckians. It's been a priority to ensure those among us who have serious medical conditions like cancer or PTSD have access to safe, affordable medical cannabis. For that reason, 2 years ago, I signed an executive order protecting Kentuckians with those medical conditions from fear of prosecution. Then last year, I signed Senate Bill 47 into law, which legalizes medical cannabis in the Commonwealth beginning January 1st, 2025. All the medical cannabis in our program has to be cultivated, processed, tested, and dispensed by licensed businesses here in the Commonwealth. Every job related to these dispensaries, processors, and cultivators will be Kentucky jobs. All of them will be owned by Kentucky LLCs or other forms of corporations. So I worked with our partners in the General Assembly, and in April, I signed House Bill 829, which moved up the timeline for licensing medical cannabis businesses by a full 6 months. That gave us a little bit longer of a runway, given that it's a lot of work to get as much of it done ahead of January 1st, which otherwise would have been the first time we could have even started taking applications. My administration did not wait. We moved forward. Beginning on that day, we have been meeting the expedited timeline, and we began receiving applications from prospective medical cannabis businesses in July. The interest was overwhelming. In total, the Office of Medical Cannabis received 4,998 applications for all license categories. A few weeks ago, we were here at the Kentucky Lottery Corporation and held the first licensed lottery for medical cannabis cultivators and processors. 26 selectees were drawn, and today I can announce all 26 have now been licensed. Today, we hold our second licensed lottery, this time for medical cannabis dispensaries. Today's lottery will be for 9 of the 11 regions. Each region will have 4 selectees drawn for a total of 36 selections today. This is another major step for ensuring Kentuckians suffering from cancer, PTSD, and other serious conditions have access to safe, affordable medical cannabis. First, we'll hear a few words from the Office of Medical Cannabis Executive Director Sam Flynn about the licensing process and the lottery. This is going to be a truly exciting moment. It's going to occur like the last one did. Sam will give comments. Then everyone will have access to a feed from the actual drawing. It's done in full transparency where not only the press, but those interested can watch and they can see how sophisticated the Kentucky Lottery Corporation is and that this is the fairest possible process. Sam?
Thank you, Governor. As the Governor mentioned, my name is Sam Flynn. I'm Executive Director for Kentucky's Office of Medical Cannabis. Today, we're here at the Kentucky Lottery Corporation in Louisville, Kentucky, where in a few moments we'll conduct Kentucky's Medical Cannabis License Lottery for dispensary applicants in licensing regions 3 through 11. I want to take a moment to thank the Governor for his leadership on this issue and his support, which has greatly helped us on our mission to build Kentucky's medical cannabis program here in the Commonwealth. I also want to thank the Governor and our partners in the Kentucky General Assembly who worked with us to change the law and move the time frame up for medical cannabis business licensing so that we could be selecting licenses today in November of 2024 instead of 2025, as we would have been forced to do under prior law. As the Governor mentioned, before we begin the lottery process, I want to provide a little background on our licensing structure and today's process. Because our program is rooted in patient access, it is critical that our cannabis business licensing framework ensures the new industry is stable and sustainable with an emphasis on small business and provides product growth to meet cardholder demand. For this reason, our initial license availability for each business category was 10 Tier 1 cultivators, 4 Tier 2 cultivators, 2 Tier 3 cultivators, 10 processors, and 48 dispensaries. A few weeks ago, as the Governor mentioned, the 26 cultivator and processor licenses were selected in our first lottery process, and those businesses are now fully licensed. In developing our lottery process, we considered the best practices used in other states and determined that this was the most fair and transparent way to build our new program. It should be noted that other states are also adopting this approach. To conduct our lottery, we partnered with the Kentucky Lottery Corporation, who has undeniable and unmatched experience with random draw processes. To become eligible for this lottery, prospective businesses were required to apply to the Office of Medical Cannabis. That application required those applicants to submit documentation and information to show that they were serious about being a medical cannabis business licensee in Kentucky. The information and documentation applicants were required to provide included an application fee, documentation that included a business history, operational plans, ownership information, business location and site plans, and other financial informations. Applicants were notified of any deficiencies in their applications, and they were given one opportunity to cure that deficiency. If an application was complete and had no deficiencies, they were approved. If it was deficient, it was denied. Some other applications were denied due to failure to pay or applying in more than once in a dispensary licensing region or for other violations. In total, 4,075 applications were submitted for dispensary licenses. 2,840, about 60% of the total, were submitted for the 36 licenses in the regions we will be drawing for today. Of those, 2,551, or 88% of the applications, were approved to be in today's lottery, and 329 were denied. And I'm going to give some information about the specific regions. For Region 3, that's the Northeast region, 162 applications were submitted, 133 will be in today's lottery. For Region 4, which is the South Central region, 478 applications were submitted, 424 will be included in today's licensed lottery. For Region 5, the Cumberland region, 258 applications were submitted, 220 will be in today's lottery. Region 6, the Mountain region, 97 applications were submitted, 82 will be included in today's lottery. Region 7, Pennyrile, 370 applications, 344 will be included in today's random draw. Region 8, West Kentucky, 304 applications, 276 will be in today's draw. Region 9, Lincoln Trail, that's 343 applications, 320 will be included in today's draw. Region 10, Northern Kentucky, 394 applications in total, and 334 will be in today's draw. And finally, Dispensary Region 11, Green River, 434 applications, and 386 will be in today's draw. I'll note that only 527 of the 2,840 applications were initially correct and did not need to be cured, meaning 1,984 applications received their deficiency notifications and were able to correct those deficiencies. Because the number of eligible applicants, of course, exceeds the number of licenses available, we'll be holding lotteries in each of those 9 regions. I want to congratulate the applicants who were notified of their eligibility for today's lotteries. As we noted, this is the most fair and transparent way to issue these licenses. Now, to the lotteries. In a moment, the Office of Medical Cannabis will begin the process of conducting each lottery for the 9 dispensary licensing regions today. To do so, the office will provide an identified CSV file and hard copy file of the eligible applicants for each category to a representative from the Office of Legal Services and the Cabinet for Health and Family Services. Those files contain the name of the applicant, its county and city location, and a unique numerical identifier. The Office of Legal Services will then provide a de-identified version of the CSV and a hard copy file to Greg Baird, Vice President of Security Operations here at the Kentucky Lottery Corporation. The file is de-identified for security purposes. The de-identified version of the file will redact the applicant's name, location, and unique identifier so that nobody at the Kentucky Lottery Corporation will know who is being selected. At this point, the lottery is in charge of and responsible for the random drawing process, and throughout this process, both the Lottery Corporation and the Office of Medical Cannabis will maintain a chain of custody of the possession and transfer of those files. Terry Sebastian, Director of Communications and Public Relations for the lottery, will narrate exactly what is taking place while the Lottery Corporation is conducting the process, and I will provide additional commentary about the license types and other information about the program throughout. After the lotteries have taken place, the Lottery Corporation will return the de-identified files indicating those numbers that were selected in the lottery to the Office of Legal Services. The office will re-identify the files and indicate on the identified list those applications corresponding to the numbers selected. The identified file with the selectees indicated will then be provided to myself and my deputy, Scotty McFarland. We will verify the selectees and upload them on your screen and announce them. At this time, I do want to mention that this entire process, as you know, will be filmed just as we did last time. And at this time, I'll turn it over to Terry, and we will begin the lottery process. Terry.
Good afternoon. Thank you, Sam. And the Kentucky Lottery thanks Governor Beshear and his administration in their mission to help build and implement Kentucky's medical cannabis program. The governor asked the Kentucky Lottery to hold these drawings because of our draw integrity. These draws are what we do each and every day. And today you will see the same draw process as you saw October 28th. You will see the same 3 longtime lottery employees conducting the drawings today. Ingram Quick, Vice President of Internal Audit, Beth Wheeler, Security Draw Manager, and Greg Baird, Vice President of Security Operations. Sam and I will give you step-by-step information during each draw, like the previous medical cannabis drawings on October 28th. So, with that being said, I will now turn it back over to Sam for the Office of Medical Cannabis to start the file transfer. Thank you.
Process of transferring over the identified files of the eligible applicants for each category to the Office of Legal Services. As you can see, Deputy Executive Director Scotty McFarland is currently signing over custody of those hard copy files to Blake Vogt, Deputy General Counsel for the Office of Legal Services in the Cabinet for Health and Family Services. Those files, as I mentioned, contain the name of the applicant, its county and city location, and a unique numerical identifier. The file is numbered 1 through however many applicants are going to be in the drawing, and the applicants are listed in a random order set by the cabinet so that nobody, again, knows which applicant is associated with which number on the file. Blake will provide a copy of the de-identified version of the records to Greg Baird, the Vice President of Security Operations for the Kentucky Lottery Corporation, momentarily. It's important to note that the file is de-identified for security purposes, so again, nobody at the Lottery Corporation or anywhere else for that matter knows which applicant these files are associated with. And the de-identified version redacts the applicant's name, as I mentioned, the location and unique identifier. And Terry, it appears that the process is now in the hands of the Lottery Corporation, as Greg now has a copy of the de-identified version.
So our Vice President of Security Operations is now delivering the numbers to our draw studio. Once he completes this, you will see our draw team take the following steps. Our draw team will review the numbers. They were just delivered in order to conduct today's 9 drawings. They will then roll a die to determine which random number generator machine to use, either even or odd. They will open or break the seal on that machine. They will separately enter their security credentials into that machine for today's drawings. I will note that this step, like all others by our draw team, ensures that there are adequate separation of security duties in our draw process. Once these procedures are complete, our draw team will signal that they are ready for today's draw. So while we wait for that, Sam, do you want to talk a little bit about the number of selectees for today's draw?
So, sure, and thank you for that explanation. So today's draw, we're pulling 36 selectees from 9 regions that are located throughout the Commonwealth of Kentucky. Dispensary licensing regions, there's 48 licenses total, and we'll be holding a licensed lottery for some other regions here in December. But today's is for regions 3 through 11. And 4 selectees will be pulled from each one of those pools of applicants for each region, meaning we'll have 9 draws today and 4 selectees from each region. Our regions were determined based on a drive time analysis working in conjunction with Kentucky's Department for Transportation. We were able to determine the regions so that folks would have the shortest possible drive time. At the end of the day, Terry, our office is focused on access and ensuring that there's access points throughout the Commonwealth. And we determined that this would be the way to provide the shortest possible drive time for any Kentuckian who is a card holder suffering with cancer, PTSD, epilepsy, or any of the other very serious conditions to the dispensary nearest them. So very important piece. Also wanted to ensure that we have a secure program, which is why we limit the number of dispensaries to no more than 1 per county, except for in Jefferson County, which gets 2, and Fayette County, which gets 2. Again, we want to make sure there's access points all throughout the Commonwealth, but that these businesses aren't sort of stacking up on one another, as you may see in some other states. Now, with respect to the rules, applicants could apply one time in each of the 11 regions, but could not apply more than once in a region. So there are some folks today that may have several applications one in each of the regions. Certainly may be the case, given that a lot of folks applied in some specific counties, that there may be one or more selectees selected for a particular county. In that instance, we allow the original county, the original applicant in that county that's selected to stay in that county, and then the subsequent applicant that's selected to move to another jurisdiction that allows for medical cannabis business operations. Again, with dispensaries, they have to stay within that licensing region, and again, have to adhere to the rule that there's no more than 1 per county. Again, this is all in guidance that's provided at kymedcan.ky.gov. Great resources there for business applicants and for patients as well. I did want to mention a little bit about, as well, Terry, about our dispensaries and how we're going to set that up and what these are going to look like and the feel that people are going to get when they walk into a dispensary here in the Commonwealth. So this is a medical cannabis program, and we're focused on healthcare. And
So it looks like we have already started the draw for this, and this is for Dispensary Region 3. And I will let Sam read the results as they come up.
okay, for Dispensary Region 3, which is the Northeast region, the numbers are 73, 60, 7, and 25. And I'll say that again, 73, 60, 7, and 25.
And so before we start the next draw, Sam, do you want to tell us a little bit about Region 3, those counties that are in there?
Sure. So Region 3 had 162 applications, about 4% of the total applications that we've received. The vast majority of those were in a handful of counties, Boyd, Montgomery, Mason, Carter, and Rowan. The rest of the counties that are not mentioned did not have any applications in those counties. So again, smaller number of applicants in that region. Some of the other regions have a little bit more in terms of the number of applications received.
Okay, so what we'll do is we'll have our draw team, they will print the results out, they will sign off on those results, and they will set them in a folder off to the side. So I will ask Ingram and Beth in the draw studio to start the next draw, which is for Region 4 dispensary. And while they're doing the draw, Sam, tell us about Region 4 and talk maybe a little bit about why we started with cultivators and processors last time.
Sure. So Region 4 is the South Central region, so that Warren County, Bowling Green area in the state. We had received 478 applications, 424 are in. The 478 represent about 12% of the total applications that we've received. So, Terry, to your question about why we started with cultivators and processors, and of course that was the license lotteries that we did a few weeks back. The reason why we started with cultivators and processors is because all of the medical cannabis, as the governor mentioned, that's going to be in Kentucky and dispensed in these Kentucky dispensaries has to be grown, processed, and tested here in Kentucky, which means we have to get these businesses up and operational. And you can't sell any plant until you actually grow it first. So we started with the cultivators and processors, and all of those, I'm pleased to announce, paid their licensing fees and are now moving towards operations. And to assist them, we are working with them and state agencies, local governments to help them become operational at the soonest possible date. It's important to note, before any of these facilities can become operational, they have to be inspected by the Office of Medical Cannabis, and we certainly have a dedicated staff for that purpose. And we're going to walk with them hand in hand through this process to make sure that they're following all the rules, but ultimately making sure that we can get medical cannabis products to patients who need it at the soonest possible date.
We are waiting for the results of Region 4, which should be coming up right now. If you want to read those as they pop up.
Sure. And it looks like they're running the draw now. And the numbers for Region 4, which is the South Central region, are 154, 186, 76, and 103. And I'll read those again: 154, 186, 76, and 103.
So our draw team will verify the results of draw for Region 4, and I will ask Ingram and Beth in the draw studio, once they verify those results, to begin the next draw, which is for Dispensary Region 5. Sam, tell us about that region and share a little bit about what's next for the program.
So Dispensary Region 5 is that Cumberland region in the state, and definitely in the southern region of Kentucky, in that more Appalachian area. 258 applications received, about 6% of the total for dispensaries. We received 220 applications there that are going to be in this license lottery of the 258 total, so about 85% pass rate, very good. With respect to where the program is headed, so the governor announced this past week some really exciting news about our patients and our practitioners. Again, this program is focused on healthcare. We want to ensure that folks suffering with severe medical conditions can have access, and we've built some pieces into our program that are going to be launching soon. They're going to help that along. The first is a practitioner directory. So all of the practitioners that are going to be part of this program have to be authorized by the state licensing board, registered with the Office of Medical Cannabis, and then they have to actually write certifications for patients. The directory, so how patients can find a physician nearest them, or an APRN for that matter, that directory will be on our website, kymedcan.ky.gov. Really handy feature that shows the practitioners within 25, 50, 100 miles of the county or city that you're located in. Also shows specialties, so you may have to go to a specific kind of physician or APRN, so it shows the specialties of those folks as well. So very handy tool that's going to allow folks to find a physician, get that appointment set. We'll also be starting the written certification piece of this. So doctors will actually be able to start writing those certifications for the patients beginning December 1st. And it looks like we have the numbers for Region 5, that's the Cumberland region, and those numbers are 132, 72, 89, and 113. And I'll read that again: 132, 72, 89, and 113.
So our draw team will verify the results of Region 5 drawing, and I will ask Ingram and Beth, once they verify the last draw, to start our next draw, which is for Dispensary Region 6. Tell us about that region and maybe share a little bit about how doctors and nurses can get involved with this program.
Sure. Region 6 is the mountain region, so truly that Appalachian part of our state. 97 applications was actually the smallest number of applications for any region. About 2% of the total. 85% of those applications are in today's license lottery, so pretty good pass rate. But with respect to your question, so we talked a little bit about how folks can find a practitioner. If you're a practitioner, physician, or an APRN, and you're interested in getting involved in our program, first thing you need to do is get authorized. So it's a three-step process. First part is get authorized by your state licensing board. You need to be in good standing. You need to have DEA credentials. You need to have access to the state's prescription drug monitoring program and 6 hours of continuing medical education. You can also own no part of one of these medical cannabis business licenses, so can have a financial interest in one of the dispensaries. Costs about $100 to get licensed or get authorized by KBN or KBML. And then once that process is done, then you come to the Office of Medical Cannabis and get registered. And that registration will allow you to write the electronic certifications into our system. So after you've seen a patient, you say, yes, they have the specific condition, you write that into our system electronically. So that registration, very simple, takes about 5 minutes, completely free of charge, and as good as long as you're involved in the program. So very important pieces there, and that will allow folks to take that third step, which is actually writing those certifications. And it looks like we have the numbers for Region 6, the Mountain Region, and those numbers are 44, 39, 30, and 68. And I'll read that again, 44, 39, 30, and 68.
So our draw team will verify the results of that draw, and I will ask Ingram and Beth in the draw studio today to start our next drawing, which is Dispensary Region 7. Tell us about that region and maybe share a little bit about how patients can go about getting their certifications.
Sure. So Region 7 is the Pennyrile region. And there was 370 applications that we received for Pennyrile. That's about 9% of the total applications. The majority of those were in Christian County, where we received 230 applications, 83 in Hopkins County. For Region 7, 344 are going to be in today's drawing, which is a 93% approval rate, which is very good, of course. Now, you asked about the written certification process and what folks can expect when they go to their physician to get their written certification. And what that looks like is first they need to have an in-person visit with a physician or APRN that's authorized and registered, and they can find them starting December 1 through the kymedcan.ky.gov in our practitioner registry. So that's the first piece. They'll need to establish a bona fide patient-practitioner relationship with them through that in-person visit. Now, it's important to note that all the subsequent visits can be telehealth, but the first one has to be in person. That practitioner has to diagnose or confirm the diagnosis of whatever the qualifying medical condition might be, so cancer, PTSD, epilepsy, what have you. The physician also needs to consult with the patient about their medical history and also consult with them about the 12-month prescription drug history that you would review through the PDMP. Finally, they'll need to fill out the written certification. The practitioner will fill out the written certification through the electronic monitoring system with the Office of Medical Cannabis within 24 hours. Now, once they've done that, that'll open up a 60-day window in which the patient can then apply for a medical cannabis card. And it looks like we have the results for Region 7 coming up. And the results are for Region 7, the Pennyrile region, 335, 179, 81, and 76. And I'll read that again, 335, 179, 81, and 76.
So our draw team will verify the results of that draw, and I will ask Ingram and Beth, once they verify that region, to move on to the next drawing, which is Dispensary Region 8. Again, Sam, tell us about this region and talk a little bit about how patients will be able to apply for the card.
Sure. So Region 8 is the West Kentucky region, truly the furthest west you can go in the Commonwealth. 304 applications, about 8% of the total, and 88% of those 304 are in today's license lottery. That's 267, so a good pass rate there. Now, with respect to the card, so we've talked through how practitioners get authorized, how patients get that written certification and that in-person visit, now the application part. So Folks can begin applying for a medical cannabis card on or after January 1st, pardon me, of 2025. So coming up in the next several weeks, folks will be able to begin applying. To be eligible, you have to have a written certification, so the confirmation or diagnosis of one of the qualifying medical conditions. You'll have to enter some personal information into our system. Once you've entered that information, your written certification from your physician should populate. You'll be able to click on that and capture it and associate it with your application. Once that's done, you'll need to upload a notarized signature page that says that you're going to follow all the rules and regulations that we have set out either through our law or through regulation, and pay a $25 fee. And we're really proud of how low the fee is. It's one of the lowest in the country for a new medical cannabis program. We're very excited about that and making sure that access is a priority in our program. Now, once you've hit submit and sent that to us, we'll check to see if you have a disqualifying felony offense. And if you don't, then we will issue a digital registry identification card, and that'll come to you through email. And it looks like we have the numbers for Region 8, West Kentucky, and those numbers are 240, 259, 70, and 196. And I'll read that again, 240, 259, 70, and 196.
Our draw team will verify the results of a draw for Region 8, and I will ask Ingram and Beth in the draw studio today to start the draw for Dispensary Region 9, talk about Region 9, and maybe talk a little bit about how people will be able to get their medical cannabis cards.
Sure. So Region 9 is the Lincoln Trail region right there in central Kentucky. 343 applications, about 8% of the total that we received. 320 of those are in today's licensed lottery, so 93%, really great pass rate for the dispensary applications in that region. With respect to cards, so we've talked through the entire process up until the individual gets a card. So now, what does that look like? So again, the medical cannabis card will be emailed to individuals when they are approved. So they'll have their digital card. They'll be able to save that on any device that they have. We also encourage folks to print that off and keep a copy in the glove compartment of their car if they are going to be driving at any point in possession of medical cannabis. So what does that look like in terms of going to a dispensary and purchasing medical cannabis? So when folks go into a dispensary, they'll have to show proof that they're 18 years of age or older, so nobody under the age of 18 can enter one of these facilities. When they go to purchase, they'll have to show their digital registry identification card as well as a government-issued photo identification so that the folks at the dispensary can see that those things line up. They'll be required to sign the first time a acknowledgement that they've received a dispensary advisory pamphlet, which again provides a lot of great information about storage, transportation, and security, and how to keep their medical cannabis safe. So very, very important pieces. And it looks like we've got the numbers for Region 9, Lincoln Trail, and those numbers are 242, 110, 17, and 198. And I'll read that again, 242, 110, 17, and 198.
So our draw team is verifying the results of the draw for Region 9, and I will ask Ingram and Beth in the draw studio to start the drawing for Dispensary Region 10. Tell us about Region 10 and maybe share a little bit about how much medical cannabis an individual can get and what is and isn't allowed.
Sure. So Region 10 is the Northern Kentucky region, so that Boone, Kenton, Campbell area of the state. 394 applications, so quite a large amount of applications, about 10% of the total. And 334 of those are in today's lottery, so an 85% pass rate for those applicants. Now, with respect to the amount of medical cannabis that folks can get, it's truly much like a prescription. So the state, the General Assembly requires the Office of Medical Cannabis to set a 30-day supply limit. Now, the practitioner for any individual can write above that or right below that. It's dependent on the practitioner. So much like a prescription in that sense. Also, the types of medical cannabis products that you can actually purchase is very much dependent on the practitioner. They can toggle, for example, they can say, yes, you're allowed to have raw plant material, or no, you're not. Or, hey, you don't need these product types. We really need you to have a capsule or an edible or something to that effect. So again, very much focused on healthcare and very much dependent on what the doctor or APRN is saying that you should get. Now, with that 30-day supply, wherever it's set, it can be purchased every 25 days on a rolling basis. Folks will be able to transport that, the entire amount from their dispensary to their home, but any other travel, they can only have a 10-day supply on them. So a very important piece with respect to the rules on transportation. And it looks like we have the numbers for Region 10, that's Northern Kentucky, and the numbers are 266, 319, 327, and 257. I'll say that again, 266, 319, 327, and 257.
So our draw team will verify the results of Region 10 draw, and we will ask Ingram and Beth in the draw studio to conduct our last drawing today, which is for Region 11. And you tell us a little bit about Region 11 and maybe share a little bit about how folks can go about finding a dispensary.
Sure. So Region 11 is that Green River region around Henderson and Owensboro. 434 applications, so 11% of the total. So very, very high number of the total applications that we received. 386 are going to be in today's license lottery, so about 89%. Great question about where and how people can find dispensaries nearest them. So much like the practitioner registry that's going live in December, we'll be having a dispensary registry that will likely be launched sometime after the new year. That dispensary registry will allow folks to find all of the dispensaries throughout the state, and it's important to note that folks can purchase medical cannabis at any one of the dispensaries in Kentucky. They don't have to go to the one nearest them or ones that are in their licensing region. Those regions are strictly for licensing purposes only, so they can go to any one of those. We'll also be putting all of the licensees and their business location for dispensaries on our website. Again, that's kymedcan.ky.gov. We also have a lot of great material, and I certainly recommend folks look at all the material that we have. If they're interested in being a qualified patient or designated caregiver here in the Commonwealth, we have a great guide on that, and the same for authorized practitioners and folks that may want to get registered to provide that kind of care. And it looks like we've got our final region, Green River, Region 11, and the numbers are 60, 309, 369, and 362. And I'll read that again, 60, 309, 369, and 362.
So our draw team will verify that draw, and then once they have done that, they will actually close out the draw process for the Kentucky Lottery's part of today's draw. That will include, here in a second, you will see Vice President of Security Operations, Greg Baird. He will be signing off on a chain of custody. Once Ingram Quick, who is signing off on the last draw, putting it in a folder and taking it over to Greg, who will sign that. And what Beth is carrying is the numbers for all of today's 9 draws. Now, Greg will bring that form, all the numbers, to this area, and he will sign a chain of custody form and deliver it to the Cabinet for Health and Family Services. Once this is complete, the Kentucky Lottery's portion of the November 25th medical cannabis drawing for dispensaries Region 3 and 11 is complete. And I'll turn it over to you, Sam, for the state's part.
Well, as you mentioned, the de-identified lottery results are back, and they're now signed over to the custody for the Cabinet for Health and Family Services and the Office of General Counsel. Blake Vogt, the Deputy Executive Director, is currently working on re-identifying the results that were pulled moments ago with the list of identified applicants. Once he's completed that process, which shouldn't take too long, he will sign over custody of that doc to the Office of Medical Cannabis. And the file that he's about to turn over will identify the lottery draw list number, the application number, the business name, county and city of the applications or applicants that were selected in the drawings for regions 3 through 11. He's currently, or I think he's currently signed over custody of that document. And Deputy Executive Director Scotty McFarland and Malaya Rivers from the Office of Medical Cannabis will now validate, or are validating, the identified results and transcribing the results on a document that we will use momentarily to announce the selectees. Once they have provided those to me, I will take those outside to the Lottery Corporation lobby where we were a few moments ago, where the governor will announce the results. And for a moment, I do want to talk a little bit about our medical cannabis program. Again, a lot of really, really important dates coming up. First, if you are a practitioner who wants to get involved in our program, please get authorized by your state licensure board. We have a number of quarterly opportunities for folks to sit in webinars with us. We've had over 1,000 physicians and APRNs join our webinars to learn about our program. We've got over 160 authorized and registered practitioners thus far, and well over 200 that are authorized, and we're working on that second registration piece. We want to grow this program on that side, make sure that there's access, and make sure that there's opportunities for care for folks, so they can get those written certifications everywhere in the state. Next piece is, again, on December 1st, as the governor announced, we will have our our practitioner directory go live, and folks will be able to find those practitioners that are currently authorized and registered and go ahead and start getting those written certifications. That's the other piece. Physicians can start writing those certifications on December 1. They're good for 60 days, so they're going to cross over that January 1st date when folks can begin applying for medical cannabis cards. So once they've crossed over that January 1st date, they can begin applying for their medical cannabis cards and move through the rest of this process. Again, we're very much focused on making sure this program is safe and secure. And there's a number of things that I want to mention that folks are not permitted to do. And again, folks are not permitted, regardless of whether they have a card or not permitted to smoke medical cannabis at any point. Our dispensaries will not allow the sale of any smokable products. Very important piece. Our dispensaries are going to look and feel like a pharmacy-like experience. Certainly how we set this program up, there's not food and beverage sales in these facilities. And no adult use hemp-derived cannabinoids are allowed to be sold in these facilities. So again, this is all about the medicine and all about health care. Other things that are prohibited, folks that are 21 years or under the age of 21 are not able to purchase or possess any vaporization products. So again, a very important piece there. And if you're over the age of 21, you cannot consume a vaporization product in a public accommodation or on public transportation. So very, very important pieces. And again, I alluded to earlier on transportation. Important rules there as well. If you're driving with your medical cannabis and you're bringing it home from a dispensary, you can have up to 30-day supply. If you're driving at any other point, you can have a 10-day supply. Highly encourage folks to have their medical cannabis card on them, on their personal device or in their glove compartment. If they are transporting it in their vehicle, it needs to be outside of arm's reach of the driver, of course. So very important rules with respect to our medical cannabis program here in Kentucky. Also note that folks that are under the age of 18 at no point can possess medical cannabis. So if they are under the age of 18, maybe they have one of the qualifying conditions, they can get a written certification. They need to see 2 doctors, not 1, but 2. They can get a written certification and get a medical cannabis card, but they will not be able to purchase. They'll need a designated caregiver, and we have a card available. It's provided by law for this process, and there's a card available for both the minor and the designated caregiver. And also want to note that with respect to designated caregivers, it's not just folks that might be the parent or guardian of a minor, but also folks can be a designated caregiver and purchase for an elderly parent or an ailing spouse, something to that effect. So if folks can't get out to purchase their medical cannabis, need somebody to do that for them, they can get a designated caregiver that can certainly do that. So again, very important pieces, and all of that is available on our website, kymedcan.ky.gov.
And so you guys will be back on December the 16th. Why don't you talk a little bit about that drawing?
Sure. So as I noted earlier, so this lottery today is for 9 of the 11 licensing regions that we have. We'll be back on December 16th to cover the final 2 regions. Those regions are a little bit different in the sense that there are 6 licenses available for each of those regions, with 2 of them being allocated for Jefferson County and 2 of them being allocated for Fayette County. And then, of course, those counties surrounding Jefferson will have 4, just like any other region, and the counties surrounding Fayette will have 4 as well. And that will really conclude our licensing lotteries for medical cannabis businesses at this time. Again, we have said from the jump that we wanted to make sure that our program was stable and sustainable. So we're going to start small, and we can always grow as the market demands. It's very, very easy to grow a program, very hard to shrink one. So that's the way we've set this up. And I believe we have the re-identified results, and I will now take these to the lobby.
Before we announce those selected in today's lotteries, I want to once again thank the Kentucky Lottery Corporation for their incredible ongoing partnership, the professionalism in which they go about doing their work. They have been an indispensable part of launching this program. I also want to thank all the members of Team Kentucky and the Office of Medical Cannabis and the Cabinet for Health and Family Services who made this lottery possible. Hard-working state employees worked through hundreds and thousands of applications. They worked on holidays, they worked nights, and they worked weekends so we could be here to take this major step. Team Kentucky and our state employees are committed to serving our citizens, and they stepped up and really showed it. All right, so now I will read the results. First, for Dispensary Region 3, the following applicants were selected. Lottery number 73, which was applicant 4062, RTZ20, LLC in Boyd County. Lottery number 60, applicant 4696, Border Construction, LLC in Boyd County. Lottery number 7, applicant number 5876, Southern Green Wellness, LLC in Montgomery County. And lottery number 25, applicant 5709, Bluegrass Blooms, LLC in Boyd County. Next, for Dispensary Region 4, the following applicants were selected. Lottery number 154, applicant 4678, Zeus Agarias, LLC in Simpson County. Lottery number 186, applicant 4323, AR-MO-KY-MS, Cannabis Ventures, LLC, listed in Warren County. Lottery number 76, applicant 5448, Promo Pulse, LLC, Warren County. And then lottery number 103, applicant 5162, Flower Radar, LLC, Warren County. Next, for Dispensary Region 5, Cumberland Region, the following applicants were selected. Lottery number 132, applicant number 2957, Reed KY Dispensary, LLC, Pulaski County. Lottery number 72, applicant 3916, ERH KY LLC, Pulaski County. Lottery number 89, applicant 3543, JM Medicinals, LLC, Russell County. And the last one for this region, lottery number 113, applicant 3217. It looks like no one boundary, LLC in Whitley County. Dispensary Region 6, the Mountain Region. First one, lottery number 44, applicant 3630, BSRKYAPP LLC, Floyd County. Second one, lottery number 39, applicant 3790, High Property Management LLC in Powell County. Lottery number 30, applicant 4181, Kentucky's Inn LLC, Pike County. And the last one for this region, lottery number 68, applicant 2981, Reed KY Dispensary LLC in Pike County. For Dispensary Region 7, the Pennyrile, the following applicants were selected. Lottery number 335, that's applicant 1269, Mallard Club LLC in Christian County. Lottery number 179, applicant 3732, ARKY Capital Investments LLC in Lyon County. Lottery number 81, applicant 4926, River City Relief House LLC, Lyon County. And the last one, lottery number 76, applicant number 4982, DPDMJF Cannabis Holdings LLC, Lyon County. Dispensary Region 8, Western Kentucky. The following applicants were selected. Lottery number 240, applicant 2316, OM Med LLC, McCracken County. Lottery number 259, applicant 1594, KY Canco LLC, McCracken County. Lottery number 70, applicant 4464, Green for You LLC, Graves County. And lottery number 196, applicant 3023, Lieber Canna 2 LLC, McCracken County. Next one is for Region 9, Lincoln Trail. The following applicants were selected. Lottery number 242, applicant 1995, Barrio Capital Partners, LLC, Hardin County. Lottery number 110, applicant 4065, Thoroughtrek, LLC, Hardin County. Lottery number 17, applicant 5495, NGHKC, Hardin County. Lottery number 198, applicant 2921, Win LLC, Hardin County. Dispensary Region 10, that is Northern Kentucky. Lottery number 266, applicant 2113, Yellow Flowers LLC, that is in Kenton County, or it was applied for as Kenton County. Lottery number 319, applicant 1737, Nicole Torella, Campbell County. Lottery number 327, applicant 1569, Bluegrass Canna Care LLC, Boone County. Lottery number 257, applicant 2134, Greengrass Cannabis LLC, Kenton County. Region 11, the Green River County, our final region. The applicants that were selected, lottery number 60, applicant 5, is that 1? 5197?
Yes, sir.
OTC KY3 LLC, Henderson. Lottery number 309, applicant number 2430, Bungalow House LLC, Davies County. Lottery number 369, applicant number 1453, Treesoft LLC, Henderson County. Lottery number 362, applicant number 1613, CP Investment LLC, also in Davis County. So congratulations to those chosen in the lottery. I'll turn it over to Sam to talk about the next steps.
Thank you, Governor. And I'd like to thank the Governor, the Governor's Office, and Secretary Friedlander, and all the members of Team Kentucky who made this lottery possible, as well as the Kentucky Lottery Corporation. For our new selectees, you will be receiving an email in the next 24 hours confirming that you've been approved to receive a medical cannabis dispensary license in the category for which you were selected, in the region for which you were selected. You'll be prompted to submit your licensing fee prior to receiving your license. If you fail to submit your licensing fee within 15 days, you will forfeit the ability to receive your license per Kentucky law and administrative regulations. And with that, I'll turn it back over to the Governor to answer any questions you all may have. Thank you, Governor.
All right, let's at least start giving everybody a question, and then if there are more, we'll try to answer as many as we can. So.
Governor, you said that the lottery is the fairest way to distribute these licenses. Kentucky Public Radio has uncovered evidence that one company, Dark Horse Cannabis, colluded to submit hundreds of applications in an attempt to gain, this is a quote from their own pitch deck, a full vertical in cultivating, processing, and selling cannabis, which I believe is flouting your own administration's regulations. Do you have a comment on that, and do you stand by the lottery process and the process by which applications were
We stand by the lottery process. We came to this process after watching how numerous other states did it. Pursuant to the questions from y'all, Sam and others went through all the applications. Each of those applications lists a different owner under Kentucky law. Each one would incorporate a separate Kentucky company, which would employ Kentuckians and only Kentuckians to grow cannabis in Kentucky, to process it in Kentucky, and ultimately for dispensaries here in Kentucky. Had we had a type of regulation where owners had to live in Kentucky, every other place that's done that, it's been challenged successfully, and they've had to go back and redo the lottery. It typically falls under the Dormant Commerce Clause, which means you can't do things like that.
What about this that she was talking about, Dark Horse Cannabis? If they fell under the similar parent company, that would be disqualified, correct?
Well, under the applications we have, there are separate, I think, individual owners listed for each of those applications. They can be working with a different company, but the owner there is a separate individual.
Even if they share boards of directors and principal officers?
Well, we haven't, go ahead, Sam.
That's correct. So board of director or principal officers, they could share board of directors, principal officers, employees. For example, in some cases, entities will enter into a master service agreement, which will allow for that business to have a partnership with other businesses that provide consulting services and other services that allow newcomers to this industry to get up and operational sooner rather than later. As the governor mentioned, these businesses, their ownership is completely separate. Each applicant is a different individual or set of individuals that owns the specific LLC that applied.
Anybody else?
Yes, just a question about Eastern Kentucky. We just saw in the results, and I just have the map pulled up we saw results come in for Boyd County and Montgomery
Right.
County. For that region in particular, that's like on polar opposite sides of that region, so for some people it still might be far. What's the plan maybe for future drawings? Is there gonna be any other emphasis on maybe filling in?
Yeah, you wanna-
holes?
So I heard the results for the Northeast region, which you were alluding to, where I think 3 applicants were selected from Boyd County and 1 was in Montgomery County. So that first applicant that is selected in Boyd County, they can stay in that county. The other 2 are going to have to relocate to another county, which allows for medical cannabis business operations. So we will ensure that there's that geographic spread and access points again throughout that region. Now, with respect to moving forward, we'll of course monitor the program in every region to ensure that there's access points everywhere throughout the Commonwealth. At the end of the day, we want to make sure that people have, again, access and they're not driving multiple hours to get their medical cannabis.
As a follow-up then, just quickly, how would that work as far as, would you all help to coordinate moving that business? Is that kind of just up to them?
Yes, so just as we have begun working with the cultivators and processors, we'll work directly with these entities, and once I leave here, I'm going to call every single one of them and congratulate them and talk to them about what their needs are. Some of them may need to move a location, some of them may need to be inspected by us at some point sooner rather than later, and we'll work with them throughout this process. With respect to moving, we have a change of location form that's on our website, so folks can go to kymedcan.ky.gov, submit or pull down that change of ownership form, fill it out, and submit it back to us, and we'll help them move to another location that works for them.
If it's determined later that more need is needed in certain regions, how does that work if you guys decide to add more dispensaries? Does that have to go through the legislature?
So no, that does not have to go through the legislature. The way we designed this program from start was, again, starting small and then growing as our patient demand grows. Just by way of example, so Ohio has about 2.5 times the population size of Kentucky, and when their medical cannabis program was sort of at its height, they had about 120 licensees for dispensaries in Ohio. So just about 2/3 the amount, or 3 times the amount of dispensary licenses we're going to have. Ours is a little bit more than that, but we have to adjust for terrain. So again, we worked with the Department of Transportation, designed regions based on a drive time analysis, make sure that this is the shortest possible drive time. So again, we'll look at that as we move forward, but again, it's going to be based on new data, so patient numbers particularly. So if things change with respect to the data, so if there's new qualifying conditions, more patients, then we can look at that.
We asked at the last straw how you're feeling about the start date. How are you feeling at this point?
Well, I'm feeling good that we are now through all but the last lottery, and we've already gotten all the processors, all the cultivators, and 4 of the labs licensed. Now, that's a big deal when previously we weren't going to be able to even start that process until January 1. So I think given what the law was, we've worked pretty fast up to now. Now we'll have to see how quickly some of these businesses move. I think they have every incentive to move quickly. But I'm going to keep the executive order in place that provides protection from prosecution for those with these conditions, again, until we've got the program up and running, and then I will rescind it. And I just add on to what Sam said. We promised to do this safely, and we promised to do it in a smart way. We can always expand dispensaries, but what we saw with hemp, with all the licenses that went out, is it crashed the market, having too many individuals that were out there licensed in the very beginning. So we think that we've got it generally right, but we also know that it's a lot easier to build if the demand is bigger than to contract and to have those that are part of our first launch struggle. So the other reason, though, that we could potentially need more dispensaries is if more conditions are added to where you can secure medical cannabis. There are still a number of conditions that are in other states' programs that are not currently recognized in Kentucky. And there are only 2 ways right now to add to it. The legislature can add to it directly, or a center at the University of Kentucky can add to it. At the moment, I'm told they're not interested in playing that role, and so we are trying to get a change in the legislation to allow the advisory board that's created under statute to ultimately make that decision.
Can you all come up with a realistic time frame on product on the market? I know we ideally would have been January 1st, but I mean, is there a more realistic?
So I think we'll be able to give you that to you soon. We've just gotten the cultivators and the processors licensed, and I think it's how quickly they start their operations. Over the next month, probably, we will have a good idea and timeline. You know, the dispensary is about finding the location, having the inspections, getting all of the permitting that they need. That is going to be able to go on concurrently with the product ultimately being created here in Kentucky. We know it will probably not be January 1, though it's going to be a lot sooner than if we hadn't gotten that legislative change. Okay?
We received some complaints about the lottery process, that the numbers are generated on site, is that right? And random numbers, and then the people who apply don't know who they are, like, as far as the numbers.
Right, that makes it fair, that no one here has any idea of who any of these groups are when they're doing it. I mean, this is the same random number generator that's used by the lottery, which is state of the art, which has been updating their practices. We believe that this is the standard and the highest standard that can be used, and it is the way that no influence whatsoever could impact who was ultimately selected. With that, I understand that there was a huge amount of interest. And when you look at the total number of applications versus the ones that are selected, there's going to be a number of disappointed folks, and I get that. My hope is as we see the interest and the number of signups, that there is a potential for it to grow, because we want anyone who has one of these conditions where their doctor or practitioner thinks it will help to get the relief that they need. So again, we can always grow the program, but we're going to do it through the data analytics. We're going to do it knowing when and if there is a bigger demand.
You guys mentioned at the start that part of this application required some proof that people were serious about it. Can you describe what that is? I mean, one of the applicants that we discovered was a poker player in California, so I'm just curious.
Sure, absolutely. We require a number of things to be provided to us, but two of the main things that are required to be provided to us that shows that a person is serious or an LLC business is serious. First, they have to show us sufficient capital. So they actually have to provide us a bank statement in the name of the LLC or the individual in that case that shows that they have sufficient capital to actually operate a business. The second thing, they actually have to have a proposed business address that allows them authority to use that property. So they can't just say, well, I want to locate in whatever county and without more. They have to actually show us this is our address, this is our lease, this is our deed that allows us authority to use this property throughout the term of the license. And that's how we show, amongst other things, that these folks are actually serious about being part of this process.
Thank you all, and we'll see you in December for the final set of drawings.